Hello, my name is Andrea Bates. I am one of the project managers in quality improvement with IPRO's End-Stage Renal Disease Network program. And I would like to welcome you to the series breaking down the 8 dimensions of patient-centered care. So this series is going to be broken down into 4 modules where we will review each dimension of care 2 at a time. Within each module, we will talk about the following, which includes 3 main points for each area. We'll give some sample conversations and some focused resources for each area. So when talking about the 8 dimensions and how they were developed, they came out of some research out of Harvard on behalf of the Pickler Institute. Studies were done on a broad range of patients and healthcare team providers, asking what they considered to be the most important aspects of a patient's care. The results were then grouped into clusters or 8 areas of care, which patients and providers indicated would affect the overall experience of care. And every principle which will be discussed can be applied in some way to the ESRD community and creating a patient's life plan. So what are these 8 clusters or dimensions that we're going to talk about? Patient preference, coordination of care, information and education, physical comfort, emotional support, family and friends, continuity and transition, and access to care. So in this first module, we will talk about patient preference and emotional support. The next 3 modules will be coordination of care and family and friends, information and education and continuity and transition, and physical comfort and access to care. So when speaking of the first dimension, patient preference, here are the 3 points to consider. Respect the values and beliefs of patients. Recognize the patient is their own individual with their own thoughts, and keep patients and their family members involved in decisions about their dialysis care and quality of care. So we're going to go through an example conversation, or what I like to call the modules or the in action. So this could be a conversation that may take place in your facility with a patient who is brand new to dialysis. So the patient may say, since I have started dialysis, so much information has been given to me, yet no one will actually sit down and talk to me about it. I need more explanation and prefer to discuss outside of treatment. Staff may respond by saying, starting dialysis can be a very scary situation. I understand how it can be very overwhelming. Patient then responds, can we please set up a time outside of my treatment to talk about all of this? Absolutely. Let's set up some time to discuss your concerns. Feel free to bring a family member if you would like. As you can see, several of you may be very familiar with having these types of conversations with dialysis patients, especially ones who are brand new to treatment. For dimension number 2, we'll focus on emotional support. And the 3 points to consider: encourage the patient to involve their family in their care. Ask yourself or ask the patient, who does the patient consider as their support system? And does the patient have any method of expressing their fears or anxiety about treatment? Are they part of a support group? Are they currently in some sort of talk therapy, or would they be interested in any of those types of services? So this too could be a conversation that takes place with a new patient, or maybe a patient who's maybe 3 months into their treatment, or even within the first year as they're adjusting and getting used to dialysis. The patient may say something to the effect of, "My family is very involved, which is great, but I think I may need some more support as I work through this new process." Staff empathizes with the patient and may respond, such as, "Never be afraid to ask for help. Can you give me an idea of what exactly you are looking for?" The patient may ask, "Can you please connect me with some local support groups or even a patient I can talk to going through the same things as me?" And staff may respond by saying, "How about you talk with our facility peer mentor? Many of our new patients speak with them and have said it is very helpful. Also, how about each week we set up a touch point for now as you are getting used to dialysis?" Some of these conversations definitely would take place when a patient is new to dialysis. However, sometimes there's a lot going on in the very beginning. And so as time moves on, maybe 3 months in, 6 months in, even maybe not till a year, the patient will start to feel really overwhelmed or feel that they're still not adjusting as well as they thought they would. And this is a great time to ask the patient, definitely, it's been 6 months, it's been a year. How do you think you are adjusting to dialysis? Do you need any extra support? And what can we do to help? So here on this slide are some resources to consider. These are just a few. Obviously, you can always reach out to myself if you have any additional questions or want any more additional information. So we have the American Association of Kidney Patients, or the AAKP. They have on their website in the patient section state-by-state support group listing and also a guide on how to start a support group. Now, I do want you to know that this is a living and breathing website. So it is updated often. And so times and support group offerings may change. They also have access to virtual support groups and resources on the benefits of support groups as well. The National Kidney Foundation has a peer mentoring program, NKF Peers. And these are where kidney patients can join as either a mentee or even become a mentor themselves. And what's really great about this program is all activities are completed over the telephone. So they're providing that peer-to-peer support all telephonically, which makes it more accessible to the ESRD community. IPRO, ourselves, we have our own peer mentoring program, and it's approved by the National Coordinating Center as well as ourselves. And patients can take courses to become a peer mentor or mentee. Once they take the courses, they can choose to do in-person peer mentoring. There's also opportunities to do it over the phone as well as virtual, such as Zoom or Duo or through FaceTime, those types of things. And lastly, the National Coordinating Center um, has a link that I provided, which has all various information and resources for new dialysis patients. So the link specifically that I have provided for you will take you to the For New Dialysis Patients page. Several resources on there, everything from treatment choices to insurance coverage to how a patient can be involved in their care. There's a whole section for newly diagnosed patients. So I really encourage you to check out these resources and just have another way for you to support your patients if they have any additional questions about their treatment. So that will conclude Module 1. Thank you so much for joining. If you have any questions or comments, my email is available at the bottom of the screen, and I look forward to sharing the next two dimensions on our next module. Thank you.